Hello, everyone, and welcome. My name is Constanza Frischen. I'm the managing director of Aspen Digital, and I'm so thrilled to be welcoming you all here today on behalf of the Alliance for Social Trust. The Alliance for Social Trust is an initiative by the Aspen Institute in partnership with Allstate, and it has three core goals. First, we want to align and strengthen players in the trust building field. Second, we want to shift public perceptions around trust. And third, we want to promote trust building behaviors at the community level and beyond. So today we are launching our new webinar series, and this webinar series is really aligned with all three of these goals. It's called Trust in Practice, Building Local Trust from the Ground Up. And over the next few months, what we'll do is we'll be bringing together community leaders, organizers, corporate leaders, researchers to explore how trust evolves, how it grows, how it gets built in real life. We'll dive into that today. Our webinar today is called Beyond Labels, and it brings together three fantastic speakers, and I'm so excited for you all to be hearing from them. But first, let me introduce you to today's moderator, who's also the Senior Director of the Alliance for Social Trust. Welcome to my amazing colleague, Jumi Banjo.
Thank you for the warm introduction, Constanza. I am excited to lead today's conversation and kick off the first of many webinars hosted by the Alliance for Social Trust in partnership with Allstate. In May of 2025, we hosted our inaugural Trust in Practice Summit, which brought together over 200 national and local leaders for a two-day convening grounded in collaboration, reflection, and a shared commitment to building trust. While the summit featured many insightful ideas and thoughts, some prominent learnings stuck out to me. Two that I'd like to highlight that are critical to today's conversation. One is that trust-based work comes in many colors. Some of it is dialogue-based, some is activity-based. Some work, as we will see today, may be labeled as civic engagement work, health equity reform, or bridging across divides, and much more. What they all have in common, though, is that they focus on building relationships rooted in trust. A second highlight is that cross-sector partnerships are essential. Lasting change requires collaboration across institutions, sectors, and geographies. And more importantly, when we connect across boundaries, we create stronger, more resilient networks for trust building. With that being said, I'd love to introduce today's panelists. During our time together, they will showcase their diverse approaches to trust building and share how they center trust in their work, the unique challenges and strengths that they face, and the principles that tie their efforts together. First, we have joining us Katie Baxter, Chief Impact Officer of Interfaith America. In this role, Katie oversees Interfaith America's impact and central services, ensuring alignment, integration, and efficiency across projects. She also stewards organizational change, strategy, and cultural efforts. Welcome, Katie. Next, we have Dr. Uché Blackstock, author, founder, and CEO of Advancing Health Equity. In this role, she partners with organizations to drive measurable change in health outcomes by embedding equity into leadership, strategy, and clinical practice. She is also the author of the New York Times bestseller, Generational Memoir Legacy, A Black Physician Reckons with Racism in Medicine. Welcome, Dr. Uché. And last, we have Raj Jayadev, co-founder of Silicon Valley Debug, an organization that focuses on community organizing, advocacy, and multimedia storytelling based in San Jose, California. Debug trains organizations across the country in participatory defense and coordinates the National Participatory Defense Network, a movement of over 45 community organizations nationally. Welcome, Raj. Now, as we jump into the conversation, I'd love to start with this question. I recognize that each of you come from different fields, whether it's health equity, whether it's faith, whether it's civic engagement, or criminal justice reform. But arguably, all of your work centers trust as a foundational principle. So I'd love to start with you, Dr. Uche. Can you start by sharing how trust shows up in your work and why you believe it's essential to the impact that you're trying to make?
Sure. Thank you so much for having me. I have so many stories because I have so many patients that I've interacted with, over 20 years of clinical practice. But I remember, and I talk about this story in my book, in the spring of 2020 when I was working clinically in Brooklyn, New York. We were the epicenter of the COVID pandemic. And I remember walking into a room with a young Black woman sitting on the exam room table. And when I walked in, she looked really scared. And I was covered in personal protective equipment. And she looked at me and she said, "Are you Black?" And I said, "Yeah." But I realized she couldn't see me because I was covered head to toe. And she said, "Oh, I'm so relieved because at least I know you'll listen to me." And I have to tell you, in that moment, what I recognized was that she had been in these situations where she had not been heard, she had not been seen by her, clinician or healthcare provider. And that, while I was so happy to be that person she needed in that moment, it made me really sad that she had had these experiences. And I've had so many more of those experiences with patients. And how that connects, the trust piece is so important for health, because what we see in our communities where there is distrust or mistrust towards healthcare institutions is also tied to mistrust towards like policing and towards other social institutions. And what that leads to is what we call a high degree of unmet needs. People actually are less likely to seek care when they need it. So we actually have patients who are already, or communities that are already in unhealthy situations, and people don't want to seek care. So that's why that trust is also important. And can I also just say that, I know we talk about medical mistrust and distrust, but I actually turn it on the other side and say institutional untrustworthiness, and that institutions in this country have historically and contemporarily proven themselves untrustworthy to our communities. And I know we can talk later about how do we engender that trust, but the burden should not be on the communities to like figure out how to trust the institutions, but the reverse.
Thank you, Uche. And it's a beautiful segue in what you talk about in the health equity space and even the anecdote you shared to the work that Raj does. So, Raj, I'd love to pose that question to you. I'd love to hear for you to share how trust shows up in the work that you do from day to day and why you also believe that it's essential to the impact that you are trying to make.
Sure, thanks, Jimmy. And it's really a powerful conversation that we're having today. I hadn't really thought about trust because as a foundational value, just because it's like the air, it's the atmosphere of the work that we operate in. And I'm a community organizer, and fundamentally, our organizing is with families whose loved ones are facing the possibility of being incarcerated, sometimes for the rest of their lives. And every week, just happened last night, families will come together at our community center where I'm at now, and they'll sit in a circle and they'll trust in the possibility that if they sit with these other people, if they brainstorm, if they create solutions, they might be able to prevent their loved one from being incarcerated. And I wanted to give that background because the context of where the trust conversation happens matters. And in the field of the criminal legal system, particularly for communities of color that are targeted and torn apart by those carceral institutions, the environment is based on mistrust. The institutions create a playing field that is supposed to foster distrust and solitude. And as a result, the reason why I wanted to bring it up is there's a consequence and there's a vulnerability that happens if people are allowing themselves to trust to work with others because the stakes are so high. When people are coming into these participatory defense meetings, they don't know who they're going to be in conversation with, but all they know is the stakes of their trust conversation is so important is the determination whether someone is incarcerated or not. And so the trust work runs counter to the designs of the institution. And that's also showing the possibility of how you move from that collective space. And so families are coming together at really the darkest time in their lives, meeting strangers they've never met before, and are being asked this really audacious thing, which is you, as a non-lawyer, as not a judge, may have the agency to change the outcome of your loved one's case. And if you do it by working with these other people. So that trust factor is no longer just a side piece. That is life or death, and fundamentally how people are going to seek the liberation of their loved one.
Thank you, Raj. Katie, I know your work comes from a different angle, so I'd love to hear how trust shows up in your work.
Yeah, thanks so much. It's such a privilege to be a part of this conversation this afternoon. Interfaith America, we have a vision of an America that embraces the power of what we call pluralism. And that's a place where we cooperate across differences for the sake of the common good. And we do this work by activating leaders. Right now, Interfaith America works in American higher education, we work in workplace and healthcare settings, and we work in general American civic life. But the work can't happen without a foundation of trust. We can't bridge those differences. We can't work towards a shared definition of the common good without trusting each other. And that's trusting across similarities and across deep differences. And we know that Americans are deeply divided right now. And so with folks' grace, I'm going to actually walk briefly through what we mean by pluralism. We have a really simple definition that I think is grounded in trust. We define pluralism as respect, relate, cooperate. So respecting is about true respect across, again, those similarities and differences. So in any situation, whether it's a community project, whether it's a workplace situation, how am I coming to the table with true interest and curiosity and respect for the folks across the table? And that's a foundation for how we're going to enter this project or this relationship together. And that's then that second component, relate. And I think this one relates to the trust piece perhaps most clearly. How are we in relationship with folks who may have really deep differences from us? So Interfaith America works across religious differences. That's been our core bread and butter for 25 years. We work across political and ideological and other angles and types of differences as well. Sometimes those differences are deep and familial. Like, what differences do we have literally with the people we share family bonds with? And in a democracy, it means how are we in relationship with people who live across the street from us, who show up to the same workplace with us every day, but with the same aim of how do we get things done? So how do we respect, how we're in relationship, and then how do we cooperate with folks? That can feel like kind of literally an elementary school word, but how do we undertake this shared project of democracy together, of healthy, functioning communities and a society together? I think we might have found ourselves in this conversation in a previous era where that sort of felt low stakes. And I think now we're in an era where that feels really high stakes. Is how do we do that? How do we say we have to live together? We may not agree on everything, but that project of undertaking living and working and being together across deep differences, that requires some trust that has broken down. And Interfaith America comes at it from an angle of there are religious differences, we have non-religious differences, but the skill set around that extends to political and ideological and all kinds of differences that we can practice how to build trust as we form relationships with people who have pretty deeply held views that might be different than what we're bringing to the table.
You know, Katie, I want to dig a little bit deeper into that, and it really connects to something that Raj said earlier. I recognize that in interfaith work, building trust often means navigating deeply held personal and spiritual beliefs. So I'd love to hear how interfaith creates the space for that kind of vulnerability and difference while still moving toward your shared goals.
Yeah. Um, I think a lot of this starts with the respect piece. Is how am I inquiring about? How am I creating space for? This doesn't mean I have to agree with what someone else is bringing to the table, nor does it mean that I am necessarily, I think there's this word complicit. I think folks really struggle with this a lot, that if I'm creating space or allowing someone to bring a different view to the table, that means I'm sort of being complicit with what they might agree with. And I think it means maybe shifting to a different set of ends, that maybe they can work on that particular value, but what we're doing here is building a relationship. We're fostering a sense of community, a sense of healthy democracy. So I was going to save this story for perhaps a little bit later, but we work on really difficult tensions around Middle East politics right now, and you might be able to say we have really different views on what should happen in the literal territory of Israel and Palestine, but we can still have a relationship here that exists domestically. And I have two colleagues, Rebecca and Janan, whose story I would love to share a little bit. And they spent the year after October 7th sharing. So Rebecca grew up in a pro-Israel household, and Janan's children are half Palestinian. And they have a deep friendship here and have spent the year after October 7th publicly sharing and telling their story and writing about their own relationship as a way to say, we have a relationship here that's a certain kind of friendship that doesn't have to always speak to what might be happening in other parts of the world, even though we have our own deeply held beliefs on that. And so both and can be true, and you might have different goals and different aims in different types of settings.
Thank you, Katie. And I love the sort of the framing of pluralism and respect, relate, cooperate. I think it's actually a good way to even think about how we approach, trust building work, in the sense of respect is necessary. The ability to relate with one another, while not necessarily agree, is important. And then this idea of cooperation. Dr. Uche, I want to transition to you because as I'm wrestling with respect, relate, cooperate, I think about health equity space, right? And the idea that in that space, trust has often been shaped by long histories of harm or exclusion, particularly for marginalized communities. So I'd love for you to share how you approach building trust, and some might even argue rebuilding trust in institutions that may have broken it.
Yeah, no, and I think it's interesting that you say rebuilding. I just say building for the first time because the trust was never there.
Right.
Because we're talking about like institutions that were built, even though they were built with the intention of helping people, they were actually also built to intentionally exclude certain populations, right? So we really have to keep that into consideration. And I think especially within medicine and healthcare, there is so much history that people don't even know, right? So people know about Tuskegee, but the roots of how the discipline of medicine was developed really was based on the exploitation and trauma of enslaved Black people in this country. Medical schools experimented on Black bodies. So we need to like really think about that when we're thinking about today and how communities interact with the healthcare system, because a lot of people don't even know about all of that. They just know about even what's happening now. And what's happening now is that we know in a lot of interactions, patients feel like they're not being listened to or taken seriously. And we see that. Like we see that even in how pain is undertreated in Black patients, and how that's been documented. We saw that that was one of the causes of the initial opioid epidemic, why it impacted white populations first is because Black patients were not given prescriptions for opioid pain medications. And so that's, that's people say, oh, well, that was protective of Black communities and communities of color. But no, when pain is not treated, people are in emotional, psychological, physical distress. They go into depression. They can't go to work. So, that has consequences. And so when I think about trust building, it's really about acknowledging the past harms, but also acknowledging how those past harms are influencing what we see today. Because when we talk about the undertreatment of pain in Black patients, that is rooted in beliefs that Black bodies are different. And that's rooted in beliefs that have emanated from slavery, where we even see today how there are different values that are used for kidney function, even for Black patients and non-Black patients, based on myths rooted in slavery that Black patients have higher muscle mass and that correlates with kidney function. So we already are seeing some of the, like, we see some of the harm from centuries ago still today. And so what's really important again is acknowledging that history, acknowledging how it shows up today. I think also the accountability piece is incredibly important. Like, so how are institutions holding themselves accountable for these health inequities that we see, right? That even despite advances in medicine, technology, and research, we actually know that today it's more dangerous for a Black birthing person to give birth than it was 20 to 30 years ago, right? And so people are saying, well, why is that the case? We have improved techniques, improved sanitation. It's because of the far-reaching impacts of systemic racism, in our communities. And so thinking about some models I have seen that have worked really well are community governance models, where we have community members involved in on the boards of these hospitals or clinics. We have um, you know community organizations that are constantly giving feedback and also are involved in helping determine what the health equity metrics are, because a hospital can say or a clinic can say what they think is important for health equity, but it's really the community that has the answer in terms of what does improved well-being look like for them, right? It may not just be, okay, I got the prescription for this medication, right? It could be, okay, now I can actually go for a walk in the park around the corner from me because, I feel safer walking there than I did before.
I'm sure, like Raj, I know your mind is spinning because you likely have reactions to some of the things that Uché has mentioned, or even just similarities that you've seen. I want to turn to you, Raj, and I want to hear about what it looks like to repair trust in your work, particularly because we recognize that harm has been done. But before doing that, I want to backtrack a bit because everyone might not be familiar with what exactly participatory defense means and what that work looks like. So I'd love for you to just give us a primer of participatory defense, and then we can talk about what it looks like to repair trust in your work, especially when harm has occurred or communities that you work with are rightfully skeptical.
Sure. Yeah. So participatory defense is an organizing model that we created here at Debug in San Jose, probably back in 2008. And it happened as a result of us as a community touchstone knowing people that were facing incarceration and facing the court system. And we didn't know what we could do about it because, as I said earlier, we're not lawyers, we're not court actors, we're community organizers. So we knew we believed in the power of collective action. We believed in community power. We didn't know how to flex that power in a court system that seemed very distant to us, but was determining the fate of lives of people we loved and cared about. And so we did kind of the thing that was most accessible to us, which was bring our organizing chops and our organizing IQ that we used in campaigns against police violence or economic justice. We said, well, if we layer that on top of a criminal legal system, that have been insulated from community power? And can we change the outcomes of cases? And namely, can those families themselves that have borne the brunt of incarceration, can they be the agents of change that determines whether their loved one is free or locked up? And so what it ends up looking like is a weekly meeting model for families whose loved ones are facing charges, um, working together to figure out what they could do collectively to impact the trajectory of the case. And what ends up happening is families who otherwise would have been regulated to just sort of watching and bearing witness to the horrors of incarceration actually have a role they could play by being an extension of the defense team. So they'll work with their defense attorney to come up with defense strategies. They'll figure out how to tell the fuller story of their loved one beyond just a case file. They'll pack courtrooms, and they'll influence court actors so that way the people that are facing the prospect of the court, prosecutors and judges to make judgments or determinations on them, know that that person is situated in a community that cares about them, is invested in them, and that those court actors are accountable to. And so that model really was about case outcomes, and we saw charges get dismissed and people take it to trial who otherwise would have taken a plea, or sentences get reduced significantly. But also, as an organizer, we were pretty preoccupied with how transformative the experience was for the families who came to those weekly meetings. Imagine your loved one got arrested, you don't know what to do, you feel outgunned, feel out of your depth, and then you walk into a room of other people you've never met before, and these are people that have a similar experience or facing the same fork in the road as you. And you connect with them and build a relationship with them in a way that you couldn't probably with anyone else in the world through the most volatile time of your life. And then you take that strength and you take that relationship and kinship you built and use that force and strength to try to help your loved one get free. And so it became an effective model. We started sharing it with other community touchstones, different shapes and sizes that looked and felt a lot like us, that wanted to have impact. And that's what participatory fence as a model is.
Thank you, Raj. I'd love to, we've talked about a bit of the I'd love to, and this is an open question for all, and maybe we can start with Katie. I'd love to talk about strengths and assets that already exist in the community and communities that you work with, that you've helped to build trust. So how have you worked with rather than around those assets? So let's start with you, Katie.
Great. Thanks so much. I think when you're talking about faith communities, this is just such an obvious example. So there is so much traditional social capital wrapped up in, again, traditional faith communities. We think of congregations, we think of churches, synagogues, mosques. Now, so many Americans no longer have traditional religious belongings. That's obvious. I mean, Interfaith America works in other sectors, but if you take it from that lens, there's what we call bonded social capital, not what social theorists, what Robert Putnam calls bonded social capital. And so in communities and on college campuses and even in workplace employee resource groups, folks gather along shared values, along shared historical traditions, and there's this social resonance that you can leverage and say, okay, here's a group of people who I think I have something in common with. So there's a lot of inherent trust there. And those people are probably naturally inclined to think about how can we contribute to our own common good, to the shared common good around us, whatever that might be. Again, the workplace, the town, the university campus. There's some of the different settings we work in. But they're also naturally inclined to be positioned for that bridged social capital. So you can take and say, okay, here's a congregation, here's a synagogue that is well positioned and the structures are in place to work with the Protestant community down the street on something. So a great example for this is an infrastructure like Habitat for Humanity. Jimmy, you mentioned right up front that partnerships are so important. Interfaith America has a large national partnership with Habitat for Humanity, also with the YMCA and Catholic Charities on a team up project. So Habitat for Humanity will bring these different groups together on an even larger project. And then these groups are then bridging their social capital. So that's the example. A recent example is one of our fellows, an Imam, Irshad Osman, who happens to work in Toronto, talked about how a lot of Muslim newcomers, by which he means new immigrants to Toronto, are going to naturally find their way to the mosque, and they might be inherently skeptical of some community organizations, perhaps for reasons of how NGOs might have been positioned in their home countries, or maybe just for simple lack of information. And so Imam Irshad has done a lot of work on how his mosque can partner with community organizations to get his members services they need or community partnerships. So he's developed programs for senior citizens, partnering the mosque with community service organizations. He also talked about a previous COVID vaccine program to help with vaccine uptake in 2021, because there's a lot of inherent trust, again, in the faith community where people gravitate toward naturally that they might not have, as Dr. Uché talked about, in the healthcare system. Again, in this case, it was especially for newcomers, although I don't think it's certainly especially for newcomers. So just so many inherent assets in traditional faith communities, but also in non-traditional and in emerging faith communities. So I could go on and on about this for a really long time, a lot of enthusiasm, but I'll pass on to some of my colleagues here.
Thank you, Katie. Dr. Uché, what strengths or assets already exist in your community and your work?
Yes, no, I agree so much with Katie, and we saw this, in 2020 and 2021 that, our faith leaders, also our barbershops, our hair salons were places where people already had community, they already had people they trusted, and so that was a space where we felt like we could help, disseminate information that was accurate and responsible. And then the other thing is another asset that we don't talk a lot about in our communities, actually community health workers, and they are lay health professionals that are usually from the community or a similar community, that do education, prevention work. They live in the community, so they are known, and the work that they do is incredibly invaluable. Unfortunately, because the way of our for-profit healthcare system, they're not often reimbursed, and compensated in the way that they should. But we've seen actually the impact of community health workers actually globally, and it's something to think about. Like if we were to invest more in the community health workforce. Health worker workforce here in the United States, we actually could do a lot of really beautiful preventative care work in our communities. So again, a lot of those assets are already there. It's about funding them, about amplifying them. And another thing also that came out of the pandemic, I said more of is, mutual aid. We know that communities have been helping each other and finding out ways to help each other and have the solutions as well.
Thank you, Dr. Uché. Raj, you alluded to this a bit earlier when you were talking about the importance of having families engaging in these conversations, in these dialogues, being a part of the court system, and really the way in which I define sort of participatory defense is that the work that you're doing is really emphasizing those that are closest to the problem, which is often what we see is not reflected in other spaces. And so, what would you say are some of the strengths and assets that you've seen in the criminal justice reform space?
Families that are trying to use participatory friends to free themselves or a loved one they're sitting on assets they didn't know were assets or has never been recognized by the institutions. And this may be similar to what Dr. Uché sees in the health field. This is knowledge about the community, knowledge of the person that the court system is making a decision on. And so a lot of what we're doing is trying to lift up the natural intelligence of that lives in a community and have it penetrate a court system that had denied it And so what that means in a more specific way is a family would create what we call a social biography packet or a social biography video, which is the court is making a deliberation on somebody based on sort of a made-up math equation of a particular charge carries a particular sentence, and I'll plug this person into this equation, and if they are accused of doing X, then they're going to get this much of time. And that's the way the carceral system works. So it really invisibilizes and mutes the true whole life of somebody, and reduces them to a single charge. And so a family that comes to participatory offense really wants to speak to their own assets, which is telling the story of their loved one. And so they are communicating what life was like before the alleged incident, the challenges and struggles that that person overcame or survived, that maybe a judge or an attorney would have been devastated by if they had to experience the same thing. Then also what their future prospects are if they don't go to prison, if they don't get deported, if they don't go to jail. And this is a life that they could have. And so they're bringing that to kind of give a fully dimensional understanding of someone is, in a court system that only saw them as singularly dimensional, if that's a way to describe it. And I wanted to say, Jimmy, too, like, I think it's totally natural, and maybe in all of our kind of fields that we're speaking on, for distrust to be the starting point. And I think I think it's very valid, very reasonable for people to be slow to trust. Because when you think of the context of the conversations, trust can cost you. And so it is such a risk to take to trust with people that you don't have deep relationships with already. And so the question, at least comes up for us a lot of times, without us even giving words to this, is why take the chance? Like, why embark on this thing that could backfire, could harm you or those you love even more? Why leave yourself vulnerable? And I think what happens, like, I know in participatory fencing, these weekly meetings where someone's sitting in the back of the room and they're like, I don't know these people. They're telling me to trust my son with them, that I should partner with them. It's a big ask. And I think what happens is they see that their aspiration could be found and located in building partnerships and relationship with these other people. And so the trust has a benefit in that it might be able to take them to a place that they couldn't get to by themselves. And that's why it's worth the risk. And that's why they come to the meetings. And I think it's just a backdrop of the conversation that maybe is important to bring to bear, given the context of the work that we all
That's powerful, Raj. This concept that distrust could be the starting point. And it made me, even though, thinking about being slow to trust, it made me think of, I'm sure you all know Brene Brown's work is mostly centered around vulnerability. And she has a quote that says, vulnerability is not winning or losing. It's having the courage to show up and be seen when you can't control the outcome. And I think when we think about what it means to be vulnerable in spaces, particularly in spaces where distrust does exist, or you have been harmed, or there have been institutional harms to your community, it is very difficult to ask folks to be vulnerable. And just in conversation, I'm curious, Katie, Dr. Uche, Raj, I'm curious if you're sitting in a room and sitting in a space across from someone who holds very different values from you in whatever realm. How do you lead? How do you approach with vulnerability? What do you do? That's a lot of people want to know. They might say, sure, but what do I do? So, anyone who wants to jump in, I'd love to hear what's the starting point. I also want to say, as you all are getting ready to respond, that if there are any questions from the audience, please feel free to drop them in the chat. We will be gathering them and asking them momentarily. So, back to you three. Anyone?
Okay, sure. I'll say, I definitely have had a lot of conversations with community members, obviously about getting, vaccinated. And, I've never come from like a paternalistic perspective because I'm also a patient, I'm also a community member. So I live on both sides, I have all these lived experiences. And I would never like my idea is not to force someone to do something. My goal is to make sure that people have the information that they need to make informed decisions for themselves and to keep themselves safe, right? And so I think coming into the conversation one with some humility, which is something that I know doesn't happen a lot within the healthcare system. There is that power dynamic between patients and clinicians. So I just wanted to also acknowledge that. And I think obviously the listening piece is really important, understanding, what are the reasons why someone may have these concerns, right? Really truly listening, and then maybe even repeating back saying, this is what I think I hear you saying, right? Is this correct? And then also just having some accountability and also asking them like, what is something like, why would you consider doing XYZ? Like, what would be an incentive? Like, so for example, my sister always talks about a patient that she had who wanted to have like a hot girl summer. And my sister does a lot of HIV work and pre-exposure prophylaxis work. And so my sister said, okay, if you want to have this hot girl summer, actually taking PrEP could make that safer for you. So just finding out like for that person, like what is like the incentive? What is on their side something that is important to them? So it doesn't feel like a one-sided conversation. And I think especially within healthcare, this idea of shared decision making is so important. Like, so it's really about like making sure that the patients have the information that they need, that they can ask you the questions that they have. And I think also recognizing that there may not be one conversation that's going to change someone's mind. And that's okay. Like, we're talking about people dealing with like centuries of trauma, right? And so realizing that the win is not necessarily getting someone to say yes. The win is just almost being able just to have conversation where you're listening and they're listening.
Thank you, Dr. Uché.
It's so I'm having no expertise in the healthcare field at all. It's so interesting how our Interfaith America's work is in general religious pluralism, but the skills are the same, right? You said the word humility, listening. I would add the word curiosity, right?
Yes.
So for us, it's about coming to the table. What bridges are you ready to build? And again, for us, it's the sake of a healthy, religiously diverse democracy with totally different outcomes in mind, but building trust. And again, for us, the caveat is we're never going to force anyone to build a bridge to be in relationship with someone they're not ready to be in relationship with. If you don't feel safe being in this relationship, you don't have to be. That's your choice. But our work is in preparing people to build bridges, maybe step out of your comfort zone a little bit. How can you be curious? Where can you be humble? Where can you listen? In recent days, I talked about Robert Putnam. There's longstanding theorists. We look to contemporary writers like Monica Guzman and Amanda Ripley, who are offering current skill sets on how to bridge divides with these kinds of skills.
Thank you, Katie. Raj?
Yeah, I would just add, so Katie might appreciate this, but there's a Buddhist term called Sangha. And it was a term that Buddha used when he was around explaining the path of liberation. And he said a Sangha is a community of practitioners who are all seeking their own liberation. So it didn't have to be the same destination. It was just this notion that this road doesn't have to be a solitary one, doesn't have to be an individualized one, and actually may be found in the collective. And that idea allows for, like I think Katie said earlier, different outcomes. Like we could have different outcomes, but we could all be sort of walking our paths in concert with one another. And that's kind of the way I see debug, is the way I see participatory defense. People have different dreams of what they think is possible. The difference is, and where the trust factor becomes really magnetic is this prospect that I don't have to do this alone. Like I don't have to like explore, say, even this health question about like how do I figure out my health destiny? Maybe that doesn't have to be an individual thing I just do internally. Maybe I could share and brainstorm with others. And so I think the trust building happens in that space. And the deepest trust happens in the most intimate moments. And I think the nature of where a lot of these decision points are, at least say, in the work that we're doing with participatory fence, it's inherently a really volatile, intimate moment. And so not having to have to feel alone in those moments is really liberating. And it might allow you to cross and connect with people that otherwise you wouldn't have taken that chance for.
Raj, Katie, Dr. Uche, thank you for those tactics, very practical, concrete, actionable steps. Katie, I want to turn back to you. Earlier, you discussed sort of the tenets of pluralism as the foundation of how Interfaith leads its work. Do you have any thoughts on how we can scale this approach to pluralism? So project level or neighborhood-based work can produce meaningful impact, but how do we preserve the core of pluralism as we expand across larger communities from neighborhood to city to state to region and ultimately nationwide? And I want to thank the audience member who submitted that question.
Yeah, I appreciate that question so much. Um, it's tricky and it's delicate. I really think, as I've been thinking a lot about this trust question, so much of trust happens person to person or at the community level. And we're called Interfaith America, and we have a big interest in scaling. And I think a lot of the scaling or a lot of the understanding the scale and the spread happens through the national partnerships that Jumi talked about and happens through storytelling and research. So Interfaith America has, as I mentioned very briefly, has a large national partnership with Catholic Charities, Habitat for Humanity, and the YMCA. We call the full project Team Up. And so the groups gather nationally. The project is anchored with the national or international organizations, but the actual work still happens at the community level. But key parts of the project, and so there are local chapters that get grants to run bridge building projects that work for their context. They choose how those projects go, but there's a whole lot of energy about assessment, evaluation, sharing the learnings, telling the stories. And so that's just one project that we run, and the partnerships, the evaluation, and the storytelling, I think that's where the scale and the spread happens. And you can extrapolate that to any kind of project or program. I think just very briefly, I think also the potential for additional national research about how do we understand ourselves. Pew is just the trust building research that Pew has done that we've been drawing on is so great. What can we build on? What else can we add to help Americans, in our case, again, Interfaith America, understand ourselves as committed to pluralism, committed to bridge building, committed to continuing to foster trust? That's a different way to spread in addition to the very local relational trust building.
Yeah, thank you for that, Katie. And this question is for you, Dr. Uche, and it actually builds on the previous question. It is from an audience member, and I think it's critical because folks want to know how we maintain and nurture trust over time. So what does maintaining and nurturing trust over time look like, especially from the perspective of institutions or organizations who want to build trust, emphasis on want, who want to build trust and continue to build alongside community?
Yeah, and maybe one thing that I've learned is that like trust isn't built in a single moment, but it's through consistent action that honor their dignity, their history, and their lived experience. And so when I think about like institutional behaviors or commitments that build trust, I think about the importance of consistency and follow through. So sustaining those equity efforts despite the news cycle, despite the political climate. I think transparency is also really important, sharing outcome data, even when it reveals gaps. representation is important. Like, so ensuring in institutions that leadership reflects the communities that are being served. And then finally, I think like respect for lived experience, like making sure that we are compensating community members for their expertise and not tokenizing them.
Thank you, Uche. So I've got two final questions that I want to ask you three as we sort of wrap up this conversation today. The first is going to go back to something that Raj said in his introduction about, you know, I don't even, or I didn't even think about trust, right, in doing this work. And you said something quite simple, but actually profound, Raj, that like, it's in the air. Trust is what we breathe and we live from day to day, and it's crucial to the work that we do. I mentioned this to you all before we started the call that I started my career as a middle school teacher. And if there's anything that is important in being an educator, it's that trust needs to be there, whether it's with your colleagues, the principal, the district, your students, your parents, etc. And as I've traveled through my career, I see that it's still embedded in all the work that I do. But I often find, and this is, part of the work that we are leading with the Alliance for Social Trust, that people say, I don't even realize that I'm doing trust building work. Am I? Like, I'm just doing what I'm doing. And so I'd love to, and I want to start with Raj. When you even think about this concept of trust, what does it mean to you? I find some people say, I don't know if I subscribe to this trust thing. What is this trust thing? But how do you define it, Raj? And perhaps there are different words for it. But what I'm trying to get to is that we know that trust comes in many different colors. And I want our participants and our listeners to see themselves in this work. And there might be something that you say that they resonate with and they go, oh, well, maybe I am a trust builder. Maybe trust is woven into the work that I'm doing. So let's start with you, Raj. We'll go to Katie and then Uche.
Yeah, I think how I would think about trust is people making a decision to be in connection with others when they have the choice not to. And there's a potential risk of doing it. And so trust lives in that space of how is someone motivated to connect with one another. And so I think that's why I said it's like in the air, because like really it's the only thing we got, like in the field that we're in. We don't control the courts. We don't control the levers of power with the carceral system or the police. And community draws with what historically, ancestrally, we've only known, which is lean on one another to push back against these institutions that seem powerful. And so it all comes from being in trust with one another, because that's our greatest asset. And I don't say that like as a bumper sticker. I say that as like a strategic organizing tactic. And I think that's why it feels so hard to describe, because it's like the only like operating system that we use is trust building. Yeah.
Thank you, Raj.
My next.
Yes.
Thanks for this little curveball and a moment to think about it. I think I might say that trust is a belief and a commitment that we're in this shared endeavor. And if I have a moment to add to that or to raise it, folks would have a commitment to acting on that, even when there's some personal risk. That if trust is going to be useful to us at all, we have to be willing to do something about it. We have to be willing to foster it, to work toward it, and to take action toward it. And I think that I appreciate Raj using that word strategy towards the end, that it's useful to us. There's intentionality there.
Beautiful. And Dr. Uché.
Yeah, well, when I think of trust, I just think of it as like the foundation for any meaningful change, like in any aspect of society. Like without it, even the most well-intentioned policies can fall flat. But with it, communities and institutions can actually move mountains. And I think a lot of like the trust building emanates from community organizing. Like, deep listening sessions, co-creating solutions, and shared decision making. So that's how I think about what trust building looks like.
Awesome. All right, here's my final question. Oh, Raj, were you going to add something?
Oh, I was gonna say, like for institutions, I think the clearest signal that they're sincere about trust building is them ceding power to community. I think that would be the clearest way they could exhibit trust in the context of building a community.
I love that.
Yeah.
Here's my final question. And in the just remaining time we have, I'll ask everyone, hot take, less than 1 minute. If someone wanted to start centering trust more intentionally in their work, or perhaps even personally, where would you suggest they begin? So I'm going to start with Katie. I'm going to go to Dr. Uche, and then we'll close out with Raj.
Great, thank you. I'm going to assume there's a lot of leaders on this call, and that's part of Interfaith America's strategies, engage leaders. So I'd say take a leadership action across difference. Where do you have a relationship already, or where could you have a relationship with someone who believes something deeply different about you than you? Can you take a risk? Can you do it publicly or publicly in a limited way? Maybe the second part is optional, but who might you be avoiding? Where could you foster a connection? Where can you connect even though you know that you disagree, and build a relationship? Whether it's personal, whether it's professional, maybe it's in a program or a project that you oversee.
Thank you, Katie. Dr. Uche.
Yes, I would just remind ourselves that our work doesn't start with fixing people. Or communities, it starts with listening, validating lived experiences, and demonstrating accountability. And so I would think about how do you incorporate that into whatever your personal or professional role is.
Awesome. And Raj.
I would say to change the understanding of where you place trust in your sort of work. So meaning make trust the end rather than the means. And I think rather than looking at this as you are trying to trust build in order to kind of flip that agenda and say everything is going to be aimed towards making trust the end goal. And that would show the most kind of, I think, sincerity of of why people are doing what they're doing. It would make it so it doesn't feel like trust is something, a commodity that you exchange or is transactional. But if you make it the end game versus the means, I think that changed the whole set of possibilities with how trust could be effectively used.
I love that. So many amazing gems. Katie, Raj, Uche, thank you for such an incredible conversation today. I've got some key takeaways that I want to share as we close out. We know that trust building takes different forms, but is rooted in shared values. We know that to build trust, we need to listen, we need to embrace difference, as well as accountability. We need to lead with humility and respect one another. There are tangible, replicable practices to share and learn from one another, and relationship building is not abstract. Trust is not built in a single moment, but through consistent actions that honor and validate community experience and input. And last, as we heard, we should all aim to make trust the end goal. I want to thank you so much. I want to thank our incredible panelists for sharing their time, their expertise, and their insights today. And thank you to everyone who has joined us. Your engagement, your questions made this conversation even more meaningful. A recording of today's webinar will be made available later. And if you'd like to stay involved with the Alliance for Social Trust, be sure to visit our website and subscribe to our newsletter for updates on future webinars, events, opportunities to connect, and much more. Thank you again for being here, and we look forward to continuing this important conversation with you all. Until next time.